Pharmacology, VT&E, and final exam review. NSAIDs. Our first NSAID, acetylsalicylic acid, which is also called aspirin. This has a buffered or enteric coating on some of them, and that can help to protect the GI tract from ulcerations and irritation. How often in cats? 5 milligrams every 3 days, 5 milligrams per cat. And this is because the cat livers are not able to metabolize aspirin as efficiently as other patients. Phenylbutazone, also called Bute. The routes are IV and PO. Intramuscularly is not recommended. And we can have skin sloughing, tissue necrosis, and a lot of pain and discomfort. The species that this is primarily used for are horses, and this is commonly used to treat lameness, fever, and as an anti-inflammatory drug. This comes in an injectable, a paste, and bolus tablets. Bolus tablets can, in some cases, be crushed and mixed with something tempting like sweet feed and molasses. Flunixin meglumine, also called Banamine. The routes are IV, PO. We avoid intramuscular injections due to the potential for clostridial infections, skin necrosis, and tissue irritation. The species that this is commonly used for is horses. Health concerns that this treats is GI health concerns such as colic, endotoxemia, and fever. And the forms that this comes in are injectable, as a paste, or as granules. Other NSAIDs, especially for our small animals, include carprofen or Rimadyl. This comes to us as a PO tablet, caplet, or as a chewable, and this also can come to us as a subcutaneous injection. The species that this is approved for is dogs. And health concerns that this treats, this is an anti-inflammatory and analgesic. Side effects include GI side effects such as vomiting, diarrhea, and melena. Melena is bloody diarrhea or bloody stools. Meloxicam, also called Metacam. The first dose is called a loading dose. The rest of the doses thereafter are called maintenance doses. The loading dose is double the dose. The maintenance dose is half. So we give a double dose first, and then we would continue on with a maintenance dose thereafter. Making sure that owners understand if they need to give the first dose, that loading dose is double, then it gets cut in half. Metacam, meloxicam works as an NSAID in our cats, can work in our dogs, but the concentration can be a little bit bigger, and we do use this in our exotics. It does come to us in different concentrations. The label here is 0.5 mg per mil. Keep in mind it also comes to us in a 1.5 mg per mil concentration, 5 mg per mil as an injection, and 15 mg per mil as a large animal formulation. So read the label carefully. You'll also notice that these little circles here are going to be different colors for different concentrations. Read it extremely carefully. Acetaminophen, also called Tylenol. Do we ever give it to cats? No, this is a no, never to cats. This is it can be okay in some dogs, sometimes rarely, but we have much better drugs out there. This is something we should usually avoid in pets, and we should educate our owners that this is not an appropriate drug for our pets. What illnesses does it cause? It can cause methemoglobinemia, which is also breakdown of hemoglobin, causing muddy brown gums. Ibuprofen, also called Motrin. Do we give this to pets? No, never. This is a no, never to pets. Illnesses, what illnesses does it cause? Acute renal failure.